This slide talks about aortic stenosis. This is something that you could see in pediatrics, adults, babies, whatever. It basically just means the thickening of the aorta. Because it's thickened, basically the size of the outflow of the vessels from this big to about this big. So there's not as much blood flow to go out through the aorta, decreases blood pressure, patients will be pale, and again, we will diagnose this with ultrasound. Aortic stenosis is a disease in which we actually want the ductus arteriosus to be working. As you can see here, we're going to give prostaglandin E to maintain that patent ductus arteriosus. So blood will be going from the pulmonary artery out to the aorta. Now the oxygenation will not be as high. What's going around the blood will probably be 15 to 18% as opposed to the 21%. But at least it's something. It will help with blood pressure issues, and the tissues will be getting more oxygen than without the patent ductus arteriosus. Coarctation of the aorta is whenever there's kind of like a pinch in the vessel of the aorta. You can see on this picture here, it's like the aorta was crimped and the top and the bottom are squished together. Look at the pictures to better explain what I'm trying to say, I guess. And the picture on this particular slide actually shows what we do to fix it. So what happens is there's the aorta, but there's a coarctation, as in something started to grow in between there and close it off. So what we do to fix it is we maintain, again, the patent ductus arteriosus. That way there's still blood going out to the body, and hopefully that will be after the coarctation. So the blood's going to go out through the aorta after that little pinched mark is there. Again, look at the pictures and that will better explain it. Signs and symptoms: decreased blood pressure, decreased cardiac output, and again, just like all of the other issues that we're going to talk about, we're going to diagnose it with ultrasound sonography. You can see on this slide the treatments for the coarctation of the aorta. Remember inotropics. Those are drugs that increase the force of the contraction. That means the blood's going to pump harder so it can push the blood through that coarctation. And then we'll give diuretics so that there's not as much blood to go through to decrease the work of the heart. And again, prostaglandin E to maintain that patent ductus arteriosus. The last heart defect we're going to talk about in this part 3 is hypoplastic left heart. It's also called left heart hypoplasia, same thing. Hypoplasia means that it did not form. So if that left ventricle does not form, that means that there's going to be very little blood flow going out to the body. The left ventricle is going to be so small that it's not going to have enough muscle to push the blood out to the body. So again, like all the other defects that we've talked about with this series, the left heart is not pushing enough blood out to the body. Hypoplastic left heart is fatal, very fatal. Really the only treatment is a heart transplant. We can diagnose this before the baby's born with ultrasounds. In fact, Ross has a relative, I think it's a cousin, who had a baby with hypoplastic left heart. It was diagnosed with ultrasound probably 5 or 6 months gestation. So the parents knew what was going on and knew what to expect, and the baby didn't make it. Again, it takes a heart transplant, and getting a heart transplant soon enough for that baby's, it just really doesn't happen that often. Very fatal. The baby's probably not going to make it.